There are 19,289 confirmed cases of COVID-19 in Canada and 5,276 cases in Ontario. Chatham-Kent has 17 cases and Sarnia-Lambton has reported 87 cases. Michigan now has 20,346 cases with 5,824 cases in Detroit. We now have 262 confirmed cases of COVID-19 in Windsor-Essex. 13 people have recovered. 25% of our cases are between 50 and 59 years of age, and 10% of our cases are 80 years and older. 40% are male, 59% are female, and 1% are unknown at this time. We currently have 7 deaths in our community. All of the deaths have occurred in individuals 70 years of age or older. 4 deaths have occurred in long-term care or retirement homes. We are currently working with 7 long-term care and retirement homes that are experiencing COVID-19 outbreaks. The health unit continues to follow up directly with everyone who has tested positive and negative for COVID-19. Those that are awaiting results are to remain in self-isolation. Overall, 1,940 individuals have been tested for COVID-19 in Windsor-Essex County, and of those tested, 275 tests are pending. Testing for COVID-19 should be based on clinical assessment. The testing guidelines have been updated with an emphasis on symptomatic residents of long-term care and retirement homes. New guidance from the Ministry of Health now requires testing of asymptomatic new admissions or readmissions to these facilities within the first 14 days of admission. Residents being transferred from a hospital should be tested prior to the transfer into the home. All residents will be required to remain in self-isolation for 14 days following their admission. During an outbreak, the testing increases to include asymptomatic contacts of the confirmed case. Our health unit will continue to work with the homes to determine testing. The guidance for testing of healthcare workers, caregivers, care providers, and first responders is that they should be tested as soon as possible if they develop symptoms of COVID-19. The following groups have been prioritized for testing in the event of shortages of testing supplies, including symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents and staff in long-term care home and retirement facilities, hospitalized patients admitted with respiratory symptoms, symptomatic members of remote, isolated, rural, and Indigenous communities, symptomatic travelers identified at a point of entry to Canada, symptomatic first responders, including firefighters, police, EMS, and individuals referred for testing from our health unit. Please continue to visit WECHU.org for the most current information and case counts. Symptoms of COVID-19 include fever, cough, or difficulty breathing. However, other symptoms can be present, such as being extremely tired, falling, having nausea, vomiting, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, please complete the online self-assessment tool at ontario.ca or contact telehealth or call your primary healthcare provider for a phone assessment or a virtual assessment. They will guide you on next steps, including contacting public health or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. As promised, we will present our epidemiological summary of COVID-19 cases in our community. But I'll take a moment to pause our excellent team of communication specialists and also namely Mike Janice, which many of you may know if you're watching the media, Mark Fry, our manager for planning, to make it all happen. It seems like there's a lot of technology and back-end work required to do this kind of events, and also to include our slides. So I want to thank you for them. Our epidemiologist, Ramsey D'Souza, the manager for epidemiology department, is also here to talk about any of the details from the data perspective. The data that I'm presenting today is based on all the information we currently have on our cases. As we are still collecting information on many of the cases, it could change slightly to incorporate additional information. So this is what we will cover in our presentation. I'll focus on the key points to answer some of the questions that everyone, including myself, is asking. And then we can draw the conclusion based on these data, which will help us in making evidence-informed decisions and public health recommendations. This epidemic curve or epi curve help us to assess the progression of the disease, whether in the community or in any kind of outbreak situation. We created this particular epi curve to show when our confirmed cases started showing their symptoms. Most of these cases started showing their symptoms in the last 2 to 3 weeks, as it's evidenced in the graph. One thing to note is the last section of the graph, which is shaded, and it's to show that illness that began during this time period may not yet to be reported. So we are trying to present with as accurate and up-to-date information as possible, but the area in the shades could change depending on what additional data we collect from our community. If we are strictly going to measure what percentage increases in the case count we are seeing based on the reported date to public health, this is what it looks like. To help understand, first case will be 100% increase in case counts, and as we continue to move forward, the changes are seen in the graph. Essentially meaning the percentage increases in case count by reported date is stabilizing, meaning case counts are not increasing substantially or decreasing substantially. I would still caution though, these modeling and numbers are based on the data that is currently available, and it may be too early to draw any of these conclusions. We need to see a longer trend to make sure that we are commenting it with certainty. The next question that comes to my mind is, how about these testings? How many people are currently being tested every day? And among those who are tested, how many of them are coming back positive? This is an indicator to show how prevalent the disease is in our community. If more people are getting tested and not a lot of them are coming back positive, that means we have and if most of them are coming back positive, then we have a problem. But if you look at the number of cases that are coming back positive is between 15 to 25%, which is still pretty significant. A word of caution though, again, these testing also include our long-term care homes and not only just the residents in the community. We are testing much more people at the long-term care homes, and the likelihood of tests coming back from long-term care home is much higher than the general population. The next thing what we look in these epi summary is to look at the age and sex distribution and to see if there's any significant outlier or significant variation among all of this. The purpose of is to show if between male and female the cases are distributed fairly evenly. Meaning if you do the math, all of these cases are, a majority of them are between the ages of 40 to 60, with the highest number of cases between the ages of 50 and 59. We use exposure history to identify potential mechanism of spread of any disease. We already knew that COVID-19 is a novel new coronavirus, and it did not existed here before. So it has to be brought in from the outside. So one of the components that we ask is about the travel history, if they travel to any significant part of the world. The data shows that at least 1/3 of the cases were travel related. The trend is changing now, though. Almost another third of these cases were a contact of a confirmed case. That is why we talk about the importance of self-isolation, even from your family member, your co-workers, to avoid infecting them and creating additional cases and breaking the chain of transmission. At least a quarter of these cases, or 26% of these cases, did not report any travel history or do not recall coming in close contact with a COVID-19 case. And we can assume that these cases are acquired in the community, hence the term community transmission. We heard some of our residents raising concerns that we are only testing people who are travel, but as we can see in this graph, there are a significant number of people who are being tested based on a clinical assessment and their symptoms and are coming back with a positive diagnosis of COVID. It's worth mentioning that we are still collecting data on roughly 11% of these cases, which our nurses are currently collecting data on. Next question that we ask is, among those who travel, where did they travel? And being a border city, we understand that our residents cross the border more frequently than others. Also knowing that the number of cases across the border is very different than what we have in our community. We further analyzed the data and broke it down into international travel, that is any travel that is outside of USA and Canada, Michigan only, USA other than Michigan, and no surprises there. And we can easily see that a little over 60% of those cases who traveled, they travel to Michigan. Looking further into the exposure, we wanted to see how many of these cases are healthcare worker or visited a healthcare facility. So among the data that we have, a little over close to 36% of these cases are healthcare worker. Almost 9% of them visited a healthcare facility, and we are still collecting data on the remaining 28%. Some of them we will be able to collect, and some we may not be able to collect. So looking at the current case counts and where we are, we had our first case 20 days ago. Since then, roughly about 5% of these cases are resolved or recovered, meaning that they are considered no longer infectious. 3% are deceased, and roughly 2/3 of these cases are currently self-isolating. About 10% of these cases are in hospital and 1% in ICU. It is worth noting that 14% of these cases are still under investigation, and it may change depending on what we find out on further investigation. Now the biggest question is, where are we heading? Last time when I showed this graph, we were in the upward trajectory with respect to the case doubling rates. Our cases were doubling at a rate of less than 2 days, but now we are doubling at a rate of more than 2 days. A slight improvement, but again, I would caution not to read too much into it, because we need to see a trend for a longer period of time before we can comment on the steady increase in daily case count. And that is why it is very, very important to keep doing what we are doing right now with respect to physical distancing, and most importantly, stay home when you're sick. Even few people not following these measures can trigger another increase in our community. Most of the businesses are closed now, except for the essential workers, and we know that they are working more than ever to meet the needs of the community. 7 of our long-term care homes are currently in COVID-19 outbreak, and in order to protect the residents and the risk of healthcare workers spreading, a number of healthcare workers are currently self-isolating based on their exposure or based on their case positivity. These long-term care home needs the worker. They need all hands on deck. They need support. If you are a healthcare worker or support staff currently not working, I request you to please connect with your employer to do the good work that you do to protect your community. Right now, it is only the essential workers that are working, and recognizing that these are important workers who are needed to ensure community safety. If these workers are not following the physical distancing, and we know some of them are not following physical distancing, and if any of these workers develop COVID-19, it will lead his or her close contact to go off duty for 14 days in self-isolation. It will lead to a significant decrease in the available workforce that are essential to maintain the operations. We cannot afford that. So I request all the essential care workers to be more responsible and maintain their physical distance. Thank you.
We'll now take questions from the media. We'll start with CBC.
Good morning. I have a couple of questions to start about the firefighters that tested positive. The question was, how do you determine when the firefighters are able to return even if they don't have symptoms?
So we won't comment on specific cases. What we do is we do have a criteria depending on the exposure, depending on the risk, and we go through those criteria individually and make those decisions individually on these cases. Most individuals recover after 14 days since the onset of symptoms.
So knowing that they worked with someone with the symptoms, should they have all been required to self-isolate for 2 weeks?
There are specific public health and management guidelines documents which we see. We assess the risk. We identify who qualifies to be in the high risk category, who qualifies to be in the medium risk category, who qualifies to be in the low risk category. And those decisions are mainly public health decisions based on the guidance, best practices, and those decisions are communicated to the specific individuals and to the employers.
Okay, and we also spoke with a doctor with the rapid access addictions medicine, and he says people with addiction issues are having a hard time accessing supports because of the last transit. Has there been any more leeway, any more conversation with the city about getting transit back?
So I did talk to the mayor, and I received some concerns from the community. We did had a good conversation about the importance of these transit. I recognize what the mayor's concerns are. The mayor recognized what my concerns are, and obviously we are all trying to do the best for the community. And that conversation, I cannot say that it ended up in any decision, but I see where he's coming from. We have made our position very clear with what we think should happen, and we'll continue to have those conversations as needed.
Thank you.
Any questions from AM 800?
Dr. Ahmed, you mentioned about the importance of self-isolating. Easter weekend is here. Are you concerned that family, friends, big gatherings are going to happen this weekend with Easter here?
Well, we are hoping that it doesn't happen, because that's what we are reminding people, that even with your closed one, even within your family, if one person gets sick, it is very easy for this COVID-19 to spread it to other family members. So people who are living in one home, obviously there is no choice. They are coming in contact with each other. But anyone who doesn't live inside your home, seeing them, having them over, could increase the risk of exposure if, by any reason, if any of them are sick or maybe early in their symptoms, they could expose to others. So our recommendations, as we are talking about physical distancing, as we are talking about staying home, we will still recommend that people shouldn't be getting together, and I think there are a number of ways that they can still try and connect with each other using technology, using social media to continue to socialize. I think that this is important. People want to socialize, and they should socialize, but in a safe way. And the best way to do it is staying home and not getting close to people who you do not live with.
Have you talked to bylaw as well as police to step up enforcement this weekend? For example, if they're driving, I'm not sure how this works. If they drive by a subdivision, they see gathering going on, or plenty of cars in the driveway, or a lot of cars in the driveway. Have you talked to bylaw or police about this?
We did had a few conversations with our law enforcement agencies to streamline some of the work. work and responsibility that are happening in the community. We didn't had a specific conversation on the enforcement piece just for this weekend, but I think it is important for everyone to take responsibility on their own, a social responsibility. Even with all the law enforcement agencies, I think it's not possible to do that enforcement in every part of the county. I think it is important that we recognize that it is our responsibility too to take steps, take measures to protect ourselves and also our community and our loved ones.
Question from CTV?
Actually, I just want to piggyback on that one. So I was talking to Kingsville Mayor Nelson Santos earlier this week, and he said that residents have been warned by law officials and stuff. Would you like to see enforcement find people now? Are we getting to that point where that needs to happen? I mean, it's happened in other communities like Ottawa and Toronto. Do we need that to happen here in Essex County?
Well, I definitely need to see people are following those recommendations very carefully, especially when we are talking about people congregating and we were talking about essential, like non-essential businesses that are happening in parks and places where a lot of people are gathering. I think I definitely like to see some enforcement on that part. And as I mentioned earlier, we're talking about our freedom at stake. Right now, we are enjoying those freedom, living in a society that allows us to do all of that things, and it is at stake. If people are not following that, there will be much more enforcement, which infringes on everyone's freedom. So be mindful. We don't want to get there, but I think at this point, if people are still not following it, there has to be some enforcement, because otherwise some people won't get it. So I think we'll just have to be careful. Progressive enforcement is something that we have always talked about, that try and educate people. Some people may not have the information that what they're dealing with, but it's about time that we've been talking about it for more than a month. So there is that education going on. It doesn't hurt to start with the education. If it persists, I think that's appropriate, that there are laws now, that there are steps that they can take, and if needed, they should be taking those steps.
Yeah, well, just a different topic. Yesterday, testing came under fire. I mean, Ford, went on record yesterday, and I was listening to radio shows, and people are just losing their mind over this. So, I'm just curious. Even today, the pending cases have gone up, and they had steadily gone down to a point I think it was 140-ish. Now it's back to 2-something. So, is that frustrating for yourself? For David Mouche, for health professionals in our area, because people are waiting, right?
Well, I think that's the fine balance. What we're talking about is we have, at one point when we are saying, okay, get more testing done, and then now you suddenly have more tests that needs to happen. And from a lab capacity perspective, if they are getting, let's say, 500 tested, I'm just throwing this number, so it's more than 500, but let's say 500 tests that they're getting every day, they are able to do it within the 24 hours. But now suddenly you've doubled that number by 1,000, then there would be a delay. And I'm not saying that the labs are not doing what they should be doing. I think there's this balance. Every time you're doing more testing, it could cause a little bit of delay, but what we know, the lab has increased their capacity. They have increased their staffing, making sure that they have the ability to do more testing. So I think it will take a few days before it all plays out. And some of those are historic. So these labs and these testing facilities are just built based on the need of the community and need of the province or need of the time. And it takes time to tweak it. As a healthcare provider, as a public health and medical officer of health, I think I would like to see the test results coming back, especially on the high-risk population, because it definitely helps us to manage those individuals in a better way. And as soon as we can get it, that's what we need. But we have to be careful. We don't want to be in a situation where we're getting into the issue of false negatives versus false positive. So we just have to be very careful about it.
Well, let's face it, this is all new for everybody, right? So I guess there's a learning curve in all of this. I assume this is going to be one of the takeaways. I talked to somebody else at the hospital last week about this, but I assume at the end of the day, when this is all said and done, this will be one of the learning lessons of the COVID-19.
Absolutely, and I think when SARS hit us in 2003, There are a number of major changes that happen in the public health world, more specifically the whole revamp of Health Promotion and Protection Act, which allowed the health unit to deal with these type of situation. I'm sure when it's all done, there will be a further review on the response pieces, the capacity pieces. There are a number of issues that would be what we can see from a lab perspective, from the staffing perspective, and even having the ability to have a lab locally. I think those are some of the conversations that would happen. And there's always something to learn, and we hope that we will all learn something out of it and put all those measures in place if we have to see this issue in the future.
Any questions from the Windsor Star?
Dr. Ahmed, from the epidemiological information that you just released, what indications are there that our social distancing measures are working?
So I think, as I said, we can only go with what the data is telling us, and when we are looking at the case counts and the doubling time that's reported by to us from the lab, if the cases are continuing to double, that means at a shorter period of time, which is roughly like less than 2 days or even getting closer to 1 day, that is a bad indication, meaning that the spread is big and more and more people are getting infected at a time when one person is infecting more than 2 people. So, and going back to some of the conversation that we had about how many cases one case will generate, and so roughly with COVID, typically one person can generate more than 2.5 people infected. So anything that we are seeing from that perspective, case doubling time under 2 days, it is a bad indication. Anything we're getting closer to doubling time more than 4 days, that's the goal. And we are seeing a slight increase, but again, I would caution very carefully that this is just an early trend. We'll have to see it going on the long way for longer period of time before we can say it with certainty. And I think people are getting it, but we still need to do more to make sure that it continues to happen. It's not the time right now to relax. It's time to make sure that we are following through and ensuring that these spreads are not happening in the community and we are going in the positive direction.
Any questions from Windsor?
On the exposure history chart you showed, it was 34% travel acquired and 30% contact with the case and 26% community acquired. What is the recent trend for these kind of numbers? I'd say over the last 7 days, are we seeing that more cases are community acquired and less are travel related now with the tests coming back with the border being closed?
So that's a good question, and I can say I haven't done that analysis that way, but what I can say that it's less of travel related now. It's more of a community and in the long-term care homes that has seen an increase. But that's a good question. I think the travel piece has gone down, recognizing that some of the healthcare workers are still traveling to Michigan for the essential work. Other than that, pretty much all the travel has gone down.
And just a follow-up to that, one of the big hospitals expressed concern about healthcare workers still crossing the border and the risk of exposure to Windsor-Essex because of that. How has it changed since then, and is your concern still the same?
Well, I think it's the risk continues to exist. We have made some strong recommendations with respect to the workers working in multiple institutions, workers returning to Canada and doing the home home self-isolation. So the moment that they're returning to Canada, we are asking them to self-isolate immediately upon entering Canada, do not go anywhere. So we're hoping that with that, we can prevent some of that community risk to the community and also risk to the family, and this is something that we'll continue to monitor.
Any questions from Blackburn?
Yeah, have you looked at any of this data as it compares to maybe other communities in Canada or Ontario? How is Windsor doing compared to, I mean, not just the numbers, but the the rate of positive cases and things like that?
And not at this point, just because of the limitations. So many of this data that we are collecting is, as I mentioned, that there are some limitations to this data. It is collected by our nurses and our people who are doing the contact investigation, and that's analyzed by our epidemiology team, and then we are presenting that data. By the time it goes up to the province and then having any of these cross jurisdiction comparison, it's not feasible and it's not advisable at this time as well. So we will be focusing more on our local data, and I hope that the other levels of government would be projecting more on the overall regional, provincial, or federal data.
Any follow-up questions from CBC?
Thank you.
Amy Hunter? Windsor?
Yeah, just a question. I know that people are really eager to find out if social distancing measures are actually working, and I know you said it takes a long time for the data to start to show, but what kind of confidence can it give to people who are really concerned that this is working and still want to, just to give them confidence that it is still working?
Well, if you're looking at the last graph that I showed from a case doubling time graph, so as I said, it's showing some initial signal that the case doubling rate is going down. I think that should be a confidence to them. But having said that, I would still caution it's still too early, and unless we keep those measures in place, we won't be able to see the difference. Anything what we are doing right now, we will see the impact 10 days after. So I think it is important for people to know that right now, whatever you're doing, you will see the change 10 days after. So whatever we are seeing right now is probably at the measure that were put in place from March 19th or March 20th or a little after that time period. So anything that we are doing right now, it will have an impact maybe a week from now to show up in the data. So as much as I can say that keep doing what you're doing, it is very important. Even a few people who are not following it, it can lead to further spread and change all this trajectory where we are heading. So make sure that people are following and people are understanding it's not over yet. It's far from being over yet. So just hold on and continue to do what we are doing. Only then we can make a difference.